Did you know that almost everyone with a spinal cord injury will lose bone and be at risk for fracture? Everyone with a spinal cord injury and their care team should be in the business of promoting bone health and preventing fractures. This podcast is about arming you with the knowledge you need to have healthy bones and a fracture-free life. Hi, my name is Wendy Murphy. This is episode 1, Introduction to the Bare Bones of Bone Health, where we will provide an overview of the Bare Bones podcast series. I sustained my spinal cord injury in 1984. I'm an advocate for the disabled community and a former television broadcaster. I will be co-host throughout the series. Joining me is my colleague Anita Kaiser and our guest, Dr. Kathy Craven.
Thanks, Wendy. So I've had a spinal cord injury since 1996, and I've been engaged in spinal cord injury research for over 2 decades. I'll be joining Wendy throughout the podcast, asking key questions and probing experts for their guidance.
Our guest today is Dr. Kathy Craven, Bare Bones Project Lead, Senior Scientist at Kite Research Institute, Medical Director of Spinal Cord Rehab Program at Toronto Rehab, and a professor at the University of Toronto. Welcome to the show, Dr. Craven.
Thanks, Wendy, for hosting and helping to orient our listeners to the Bare Bones podcast series.
I'd like to start by asking you, Dr. Craven, why is it important for those of us living with a spinal cord injury to learn about bone health?
Well, Wendy, your skeleton is made up of 206 bones that form a complex system that combines to provide support for movement, protection for your soft tissues and organs. It also helps to produce blood cells, store ions, regulate your endocrine system, and of course, support movement. Understanding your bone health will help you to minimize the risk of fracture and fracture-related illness and death.
Thank you, Dr. Craven, for explaining the importance of learning about bone health. So I know that you've also been involved in developing guidelines for managing bone health, but can you just take a moment to explain to us what are clinical practice guidelines?
Thanks, Anita. Clinical practice guidelines are statements from a group of experts that guide healthcare providers and patients in making decisions about their care in a specific situation. Clinical practice guidelines can cover topics related to the diagnosis or management of a health condition, or inform health policy or the design of health programs and services. However, guidelines are only as good as the processes used to develop them. Good guidelines should specify the actions the healthcare provider and patient should take, and the quality of evidence and the degree of support for the actions recommended by medical experts. It's vitally important for listeners to understand that guidelines are general recommendations for healthcare providers and not the substitute for the advice of a physician or healthcare provider who has done a detailed assessment of you and your needs.
So now that we understand the importance of why these guidelines were developed, can you briefly tell us who else besides yourself were involved in this process?
The PVA Bone Health and Osteoporosis Management Guidelines were developed by a group of 15 experts in bone health and spinal cord injury from around the world. Full disclosure, I was the panel chair. The panel conducted a detailed literature search, or what some scientists might call a systematic review, on a series of topics related to bone health, fracture detection, and management, with the help of the SCIRE team. We identified 5,482 results and chose to include 124 studies that were of adequate quality and free from bias. From these studies, there are 64 recommendations that make up the clinical practice guideline. The guideline published by PVA was developed for healthcare professionals and includes 9 chapters. But we now need to bridge the gap between the guidelines for the clinicians and the ability of people with lived experience to understand and act to reduce their fracture risk. We have worked together to develop a series of 9 podcasts and related handouts. Each podcast is paired with an action planning tool on our website that gives information related to the topic of each episode to ensure that people with lived experience and their family caregivers understand the clinical practice guidelines content and advises them how to maintain their bone mass or reduce their fracture risk.
Now that we have that out of the way, Dr. Craven, how do we use the action planning tool handout?
Thanks, Wendy. Each handout is designed to serve as a reminder of what you heard during the podcast. Each handout has a title at the top, letting you know which podcast episode it belongs to. At the bottom of each handout, there is a finger pointing to a key action item that we want you to remember and follow after listening to the episode. In the middle of each handout, there is some background information that will be useful for you to review and discuss with members of your healthcare team. The information in these handouts and podcasts are not intended to replace medical advice. Readers and listeners are advised to discuss their individual circumstances with their physiatrist, family doctor, nurse practitioner, or treating therapist. These handouts can be freely shared with friends and colleagues, but cannot be altered without permission of the Bare Bones podcast team.
So, Dr. Craven, can you tell us a bit about the podcast itself and what we can actually expect to listen to throughout the series?
Thanks, Anita. There are 9 podcasts throughout the series. They are designed to be listened to in order from 1 through 9. However, each podcast can stand alone as its own specific topic. Each episode is about 10 to 15 minutes long and covers topics that are covered in the PVA CPG. So episode 2 covers Fracture 101, things that you need to know about your medical history, risk factors for fracture and falls. Episode 3, Blood Tests, A Window into You, talks about what blood tests and serum screening you should have done in concert with your doctor. I See Your Skeleton talks about the importance of measuring bone mineral density at the hip and knee region and to estimate your fracture risk. Vitamin D for all and calcium for some talks about the role of vitamin D supplements and dietary modifications to ensure an adequate but not excessive dietary calcium intake. Get Moving and Loading really digs into the role of rehab therapies and which ones will help to make your bones stronger. There's a discussion of drug therapy in the chapter on pills or poisons and atomic habits. Snap and Crack is the chapter about how to recognize a fracture and how to initiate fracture management to prevent health complications and fracture-related morbidity. And the last episode 9 talks about future directions in bone research that you may want to learn about or become involved with over time.
Now, can people listen to 1 or 2 of these episodes, or do they have to listen to all of them?
Listeners can certainly jump ahead and listen to one episode that is of interest to them. For instance, if you just had a fracture, you might be interested in Snap and Crack, or if you had a swollen leg and you weren't sure the cause, you might be very interested in chapter 8, or you might jump to vitamin D for all and calcium for some if you're interested in nutrition interventions to augment your bone health. But ideally, the person would experience the combined benefits of listening and reviewing all 9 episodes in the series, but certainly people can go to one and just get the targeted learning in the moment that they need.
Thank you, Dr. Craven, for kicking off this podcast series and providing an introduction to a very important topic. So to wrap things up, what would be your take-home message?
Knowledge is power. We really want you to see the complete picture for healthy bones and a healthy life.
Today's talk interesting, check out our action planning tool on the website at www.scifragments.ca. Feel free to send us your feedback using the survey provided on the website. In the next podcast episode, we'll talk about Fractures 101. Special thanks to the people with lived experience who acted as podcast reviewers and helped us to refine the podcast content over time. We wish to acknowledge that funding and support for the development of the clinical practice guidelines were provided by the Paralyzed Veterans of America, the Consortium for Spinal Cord Medicine, the Department of Defense grant number SCI 50092, and University Health Network Foundation. We appreciate the input of the clinical practice guideline panel members for their willingness to serve as experts throughout the podcast series.
Special thanks to the Paralyzed Veterans of America Education Grant Foundation number 867 for funding creation of the Bare Bones podcast.
The Bare Bones podcast is co-produced by Hope Jervis-Rademeyer and Anita Kaiser. The content production team includes Dr. Lynn Bogue, Anita Kaiser, Wendy Murphy, Dr. Masai Miyatani, and Dr. Hope Jervis-Rademeyer. Handout production was done by Dr. Masai Miyatani and Lindsay Blenko, and the evaluation team includes Dr. Lynn Bogue and Dr. Masai Miyatani. The executive producer, Dr. Kathy Craven. This project team is affiliated with Kite Research Institute within the University Health Network.